Hello, everybody. Thank you for watching this short video, and I'd like to answer this question during this short talk, how to have a cooperative child in your life. So, after finishing my residency program and starting working as a general ophthalmologist, I realized that many of my colleagues are running away from examining children, and they were so happy that I love children and I know how to deal with them. The second realization is that many of my colleagues, whenever they are facing uncooperative child, they will do examination under anesthesia for those children. And I think that is not the proper way to deal with uncooperative children because repeated examination under anesthesias have many risks on the children. And personally, I rarely do examination under anesthesia only if I'm suspecting something life-threatening like retinoblastoma and I cannot examine the child in details while he's awake, or I'm having a child who is glaucoma suspect and I can't measure the intraocular pressure and I can't see the optic nerve properly. In such situations, I do examination under anesthesia. Otherwise, I manage how to examine the children whether he's cooperative or uncooperative in my clinic and elicit the important signs without doing um, examination under anesthesia for those children. So, in this topic, I'd like to share with you some of the hints, tips, and tricks that I learned through 12 years of experience. And I hope that at the end of this lecture, you will get one or two new hints, tips that will help you in examining your next child in the clinic. So, first of all, you need to be prepared. So you need to have the instruments, the toys, proper decoration of your clinic. You need to have a calm place, no distractions, no noises in your clinic. That will help a lot in having a calm child. So as I mentioned, you need to have fixation target, other fixation target with pictures, some toys with sound that will help a lot with small children. Also, if you have some pictures on the walls of your clinic, that again will help a lot in distracting the child and making him love your place and love your clinic and be more comfortable. So, how to have a cooperative child in your life? Now we will answer this question. So, first of all, always focus on companions. So, whenever you have a small child and you want to examine him, if you can start by examining his elder sibling, that will make the child more comfortable to be examined after them. Also, do not stare on the child. That will make him scared. And we will elaborate in these points shortly. Smiling, always smile. Children are very smart and they can feel the energy. So if you are smiling, if you are having calm voice, that will help a lot in making the child more comfortable and it will let him cooperate with you more and you will be able to elicit all the signs that you need to know about and you will be able to complete your examination without any problems. So keep smiling and keep spreading that positive energy during the examination. Look without staring. Sometimes especially when we are examining the extraocular motility or the cover test, we are staring because we are so attentive to elicit the signs or know the problem that the child is having. But believe me, staring at someone is very uncomfortable. And for children, it will be scary as well. So look without staring, watch yourself. And whenever you are staring, stop that and look normally. Age versus mental maturity. I think all of us met that 3-year-old child who is very confident, smart, and will let you do all the examination without any problems, without crying. Even though some of those small children will let you do the intraocular pressure measurement without any problems. In the opposite, all of us also face that 9-year-old child who is scary and he will ask you about everything before doing what is this? Is it painful? What are you doing? And so on. So you need to assess the mental maturity of the child in your clinic, whether he has a higher mental maturity above his age or lower mental maturity below his age. And that will help you a lot in dealing with the children properly. Distraction. You need to keep the child distracted all the time from the surroundings. He is with a stranger, which is you, and in a strange place, which is the clinic. So you need to keep the child distracted from all these stressful things with a lot of toys, with some children's songs in your mobile or tablet. You need to keep the child distracted from the surroundings and also be focused on that toy, so you'll be able to do your examination without any problems. Also, remember, always use positive language. So whenever you say to the child, don't cry, he will think of crying. Whenever you say to the child, don't be scared, he will be scared. So try always to use positive, like it's going to be okay. That is an easy part. You will be fine. Such things will soothe the child and will make him more cooperative and more comfortable. Be the good person always. So whenever you have any painful part of your examination, like instilling the cycloplegic eye drops, don't do this part in your clinic. So send the child outside with his parents and ask the assistant outside to instill the eye drops, and do not be involved in that part as much as possible. So the child will always think that you are the good person and the outside one is the bad person. That is okay. Be always the good cop, because you need to establish a good rapport with the child and you need to make the child love you. So do not be involved in any painful parts of the examination and be always the good person. So that's about looking with steering. So it's really scary and uncomfortable even for adults. So try always to look without staring. Distraction, as I mentioned, you need to have multiple toys. You need to have some toys with sounds that will help a lot. And remember, with small children, you have that rule of one toy, one look. So you need to have many toys because the child uh, will focus on that toy maybe for a few seconds and then he will get bored. They need to have another toy so he will be attentive with you through the examination. So second parts of the tips about how to have a cooperative child in your clinic and in your life. Patients must be always in their parents' lap. So especially children who are less than 7 year old or children with developmental delay or some um, mental issues, you need to keep those children in their parents' lap all the time. They will be more comfortable and they will let you finish the examination comfortably. Sleeping, that is another strategy that I use a lot with uncooperative children. So whenever I finish the first part, which is inspection and checking the fixation pattern and doing the cover test, extraocular motility, pupillary examination, then the remaining part usually will be the cycloplegic refraction and the fundus examination and sometimes intraocular pressure measurement if I need to do it. So I will instruct the parents to make the child asleep after instilling the eye drops. So when they will come to me to the second part of the examination, the child will be sleeping and I can finish my examination without any problems for me and for the child as well. Rapport, as I mentioned, you need to establish a good rapport with the child and you need not to finish the whole examination in one sitting. If you feel the child is extremely uncooperative, you can always give him some rewards, some sweets, and establish good rapport and ask the parents to bring him next week or something. Then he will be more cooperative with you because he now knows you and he know that you are the good guy that is giving him sweets. Then he will be more cooperative with you the next visit. Order of the examination is very important. So usually start with the non-invasive parts like inspection, extraocular motility, maybe from half meter away from the child, then the fixation pattern to check if the reflex is central in both eyes or not, and to check if the child is having nystagmus or not. And then you can proceed with the cover test and then only proceed with other examination like anterior segment, posterior segment examination. And I usually use the indirect ophthalmoscopy with the 20D lens to check the anterior segment. It gives you some amount of magnification that will help you. And if I'm suspecting something, then I will put the child on the slit lamp or I will use the portable slit lamp to have more details. Because usually children scared a lot from the slit lamp because they feel it's very large and they don't know if it is harmful for them. So most of the small children will be scared from the slit lamp. Rewards, as I mentioned, sweets, small toys. Those things will make your life easier and will make the child happy, and that will make the child love you. Demonstrate your examination. So you can always start examining the elder sibling or the father or the mother, and then the child will feel that this is not scary, this is not harmful, then he will let you do the examination on him without any problems. So this is about patients in their parents' lap. That's very important, and it's very comforting for the child. And it's also easier for you because the parents will keep the head straight. They will help you in making the examination easier and quicker. And rewards, as I mentioned. I think it's really a journey to know how to deal with the children, but it's a very important journey, and it's very important to elicit all the needed signs to establish a diagnosis and to help the child to see better. I hope that this short lecture was useful for you, and thank you for listening.